Cystograms are fluoroscopic procedures that use water-soluble contrast to visualize the bladder.
To set up the room for a cystogram procedure, you will need a patient gown, Foley insertion tray, Foley catheter, cystogram tray, gastrographin, which is a water-soluble contrast, an IV pole, hemostats, chucks, syringes or flushes, and tape.
When you have all of the necessary materials for the exam, bring the patient in, have them change into a gown, and have them empty their bladder. If the patient has a Foley catheter, have them empty it in the restroom. Double check the patient's ID, obtain a medical history, and ask whether there is any chance of pregnancy if appropriate. Be sure to explain the procedure thoroughly and allow time for questions. Ensure you explain the use of contrast, its potential side effects, and the contraindications. Have the patient sign a contrast consent form.
The patient will lie on the table and a scout image will be obtained. If the patient does not have a catheter, one will be inserted under sterile conditions using the Foley catheter tray. Tubing will be connected from the Foley catheter to the contrast media. The contrast will be administered through the catheter into the bladder using gravity flow from an IV pole.
After the bladder is distended by contrast administration, images will be obtained using fluoroscopy. Help position the patient in the overhead tube to obtain an AP and apiaxial view. Then, instruct the patient to turn onto their side using a positioning sponge to get both an RPO and LPO view. By doing so, the patient will be lying on their back while a positioning sponge is placed under the right side to rotate them approximately 45 degrees. The sponge will be removed and repeated on the left side.
Place the patient in a lateral position.
Carefully remove the catheter and allow the patient to use the restroom to eliminate any remaining contrast. The patient will be placed on the table once more for a final post-void image to assess for residual contrast. After this point, the patient can change back into their clothing and the exam is complete.
Yeah! That was legitness! Yeah, it was.